that's the spinous process here. And maybe we've determined that this is the hypomobile segment. Maybe this person says, you know, when I bend backwards or forwards, it really kind of hurts right on the left side here. And we've done some PAs, and this is the tight one. This is the segment that seems to be a little stiff. That would be why we would want to do this. But because this is a distraction, it could improve flexion or extension. That's why no matter what technique you ever do, you always want to check that concordant sign or the asterisk sign. What was painful before, and what's the effect after doing your technique? That'll let you know if you're on the right track or not. So you find the segment that you want, one finger below, one finger above in the inner spinous spots. Okay, I'm going to switch hands actually. Here. Their more superior top arm is just going to rest down on their ribs here. You're going to come and grab the bottom arm and rotate them to a point until you start to feel movement at your index and middle finger. So you rotate up. There we go. And then they'll hold their wrist here. You'll sneak through this little opening. There you go. And sometimes if your patient's really loose, tell them, try to grab your own elbow.
Mm-hmm.
That'll lock them in a little tighter. So I'm still palpating the inner spinous space above and below. We then flex the top leg until we feel some movement. There. And then their foot just rests in that popliteal area. Your thumb moves up to the top of the spinous process. So I'm not right on it. I'm kind of on the left side of the spinous process here. My weight comes down almost onto her. My forearm is just slightly posterior to the iliac crest. And then that's the mobilizing force there. Okay? Like I said, the setup is the most important.